Okay.
So, just give me a minute. Okay, I'll just share because Solomon, I remember that you joined a bit late. I'll just go through a bit about what we've covered already. It's just a very quick recap, and it would be helpful for the others also, for Richard also. Yeah, so I'll just share my screen. Please let me know once you see my screen. Is it visible?
Yeah, it's now Nolin.
Yeah. Okay, great. So what we
Sure.
were doing was, can you hear my voice well?
Yeah.
Okay. So what we were aiming in this unit was supporting individuals in adult social care. And the aim of this unit was to support developing your skills and knowledge that you require when you're supporting individuals in adult social care. So we took you through ways where you could look at practical aspects of adult social care and how these contribute to health and well-being of service users. It's unit level 4, and its credit value is 15, and there's a pass, merit, and a distinction. So obviously, people who have a distinction are they're compared to the others, they've put more effort, and that effort we see through their assignments. So your assignment is basically your output that you have to show how much you've worked upon, or how much you've learned. So in order to achieve this unit, you would produce work which demonstrates achievement of the learning outcomes at the standards provided by the
This
assessment
meeting is being
criteria.
recorded.
I'm sorry, there's someone speaker. It's on. Yeah, Bola, can you turn your speaker off? And you're. I think you've joined from 2 links.
Yes,
Yeah,
I'll do that now.
that's okay. Thank you. Yeah, I was just echoing. Thank you. Okay, so in order to achieve this unit, you would produce work which would demonstrate achievement of the learning outcomes. So there were 4 learning outcomes that we discussed. And we have certain standards of assessment. So these assessment criteria, you have references, they're all there on Moodle. Every unit has its own learning material there. So if you want to have a look at how you would reference, it's Harvard referencing that we recommend. So we do recommend up to 5 references in your documents, because otherwise then it is copy pasted. And please be aware that we highly recommend not to use AI or any other commissioning agencies or any other support online to complete your tasks. By that, I mean, you might want to use, let's say, something that's very close to AI, like Grammarly. So Grammarly, there's a Grammarly, there's one software where you don't have to pay for it. That's okay, just for minor corrections. But the one that does all your work for you, where you have to pay for Grammarly, that is highly. So we have these detectors, and if we do have this understanding, we have a rigorous check. So if that candidate is found guilty of using any of these, it's then an academic misconduct, and then that case is then escalated. Yeah, having said that, so I don't know what I've done. Just a minute. Yeah, this is better. So just a bit about what we had covered already. I'm not going through the presentations because obviously they're 1 hour long, each one of them. But I'm just going to talk through what we've what we've covered in the past few weekends actually. So yeah, so your assignment would obviously have to be done according to the recommended guidelines, which will be given to you, which have been shared on Moodle. So you would apply a policy, guidance, legislation from your own national context, wherever it's appropriate. You have the opportunity to achieve a merit or a distinction grade, where you would demonstrate that you've achieved all the criteria set for these grades. So a bit about the assessment criteria. So the first learning outcome we talked about, understanding communication and in adult social care. Anyone, do you have any, like, can you recall what we talked about this during this session? I know it's been quite some time, but any idea, any bullet points anyone remembers or anything related to it?
Sorry, I don't understand what you're asking.
Yeah, so the first learning outcome that we talked about, let me start my annotations just a minute. Yeah, so it was this that we had covered, the first learning objective. So it was understanding communication or the importance of communication in adult social care. Do you remember what we talked in this session? Can you recall anything from there?
I could remember that we talked about the modes of communication in social care.
Mm-hmm.
We talked about the
Yes.
importance of communication in social
Yes.
care.
Yes.
Then we talk about the barriers in
Yes.
communication and other the means of overcoming those barriers. I mean, those things that we can do to overcome those barriers in communication. And
Yes.
the factors and other things are factors that affect communication.
Mm-hmm. Yes.
Yes, I think
Yeah.
that's what I can remember for now.
Yeah. And then there were ways where you could remove those barriers. Yeah. Anyone who remembers the ways where we could remove barriers, any one or two ways how to eliminate or to reduce those barriers once you've assessed them?
Okay.
Yeah.
How to remove a barrier in communication to avoid local language, like language that the person don't understand.
Mm-hmm.
You have to speak the language that the individual or the vulnerable understand. You have to
Yes.
avoid that.
Yeah.
And two, you have to speak clearly so that the person understand, and you have to listen clearly.
Yes.
Thank you.
Yes. Thank you. Was that Richard?
It is.
Okay.
Hello. Yeah, it is. I'm here with you.
Yeah, that's fine. I didn't know who was speaking. That's okay. So, so that's
Please, sorry.
yeah. So that learning outcome, you understand that completely. That's good. So in order to gain a pass, only a pass for this, you would want to analyze the importance of effective communication. So an analysis would obviously go beyond. It's just not going to be one-liner or one paragraph. So you would want to understand what are the effective communication skills or communication techniques in order to improve your care towards adults in a social care setup. Just a minute, sorry. Yeah, there's a lot of background noise because I can't really help it. I'm in another country, actually. I'm not in Pakistan. I'm not in the UK. So I'm teaching from another country where these background noises, I can't really help it at times. So apologies for that. Okay. So understanding communication in adult social care. So you would analyze why is it important effective communication, what is the importance of effective communication, and how this can be applied in practice to meet the needs of service users. And then you could also assess the requirements for record keeping and reporting in adult social care. So these are the ways where you can just pass your this bit of your assignment. And if you want to gain a merit, you would evaluate application of best interests in cases where service users are unable to consent. So what would be your, how would you go one step ahead in order to, when you understand what is the best interest of the service user, how would you go one step beyond your whatever you're doing, your normal duties, whatever you're doing, when you have a service user who is unable to consent. Before I go through this, I'll just quickly skim through. Yes, so this is what I wanted to go through. This is a brief summary of what we had gone through in our 4 sessions. So the first was understanding communication in adult social care. So we talked about methods of effective communication, which were verbal, non-verbal, which included body language, sign language, use of pictures, and written communication, which is reports, emails, texts, or letters. So any one of these. Now, when you're talking about person-centered approach, you would want to know what their requirements are in order to keep it very personalized. When do you use these different methods? Choosing the best method depending upon the needs of the individual. So you're making it customized again. Urgency of communication. How urgent is it? So you won't go for ordinary mail. You'll go for urgent mails, obviously, if it's through mails. And please remember, confidentiality is very, very important. That cannot be ignored at any time. What is the importance of communication in health and social care setup? We talked about that. We talked about reasons for communication, for making choices, developing relationships, not only with yourself and the service user, but also with the teams that are working with you, because it's always going to be multidisciplinary. You're going to talk about building relationships with the people who are associated with the service users, like their relatives. This is to give information, empower them, partnership working, and consent. We talked about factors like Amibola. She mentioned that there are certain factors that hinder or affect your communication, that include your environment, your emotional or their emotional state, and different other conditions. Barriers would be physical, perceptual, emotional, cultural, language, gender, interpersonal. How to overcome those barriers? So we talked about adapting communication. So if you could keep a chaperone with you while you're communicating with the patient, that makes it easier for them to communicate with you. Always ask if they require one. Assistive technology is also very helpful. So if they have hearing problems, you could give them hearing aids. Interpreters, translators, visual communication when the language is not understandable and you don't have any interpreter at that point in time. And advocacy when some problems cannot be solved, some communication problems cannot be solved, you would need external advocacy. Impact of pure communication on staff, so they're not aware of what their job description is, for instance, who's doing what. Poor decision-making, risks such as wrong medication treatment when you're not record keeping properly or you're not communicating. So record keeping is also, it's a form of communication. Poor relationships, upset service user, low morale, etc. And then, yeah, we've talked about this. Using positive communication. So how do we use it? It's active listening. Always listen. It should be a two-way communication, especially when you're talking about having it person-centered. Adapting communication. So if one communication way is not working, always adapt. Do things according to what you would do as if you had your own family member there. So do it in that way. Empathy, again, friendly. The environment should be friendly. Giving and receiving feedback is very important for continuous improvement and respect. Use of assistive technology such as telephone relay systems, voice recognition software, apps and social media, text-to-speech software, hardware, hearing aids, induction loops, optical magnifiers in case they can't see properly, brailles and audio transcription, audio books. Use of interpreters and translators can also be there. Visual communication, there are different softwares that can be used. The most common ones are sign languages and use of pictures. And what's the need for and use of advocacy to support communication? So there's certain legal requirements for advocates and what advocates are and what they do. We've talked about that. Communication skills include your speaking, your listening, body language, written communication. And principles of effective communication involve having a message that is clear, it's concise, and it meets the audience needs. So if you're talking about breast cancer, and if it has children in that room, it's of no use. So always remember, whoever's your service user, you have to cater to them and you have to alter your communication according to them. We talked about checking effectiveness of communication, like asking questions, summarizing at the end, confirming their details, asking if anything needs to be added or needs to be altered. Adjusting communication, we've talked about this. Importance of confidentiality and risks to confidentiality. Always remember, confidentiality is one of the legal rights of every individual. So you must maintain that confidentiality. Consent, what happens if there's lack of consent, if there's no capacity to consent. We talked about different definitions, requirements for record keeping and reporting. Importance, what's the importance of record keeping? Why do we go one step ahead and keep these records precise? Why do we need that? We talked about when we're not going to comply, what could happen. Use of records and reports to support decisions, best practices in reporting and recording, and use of ICT, information technology for records and reports, and how do you secure them and make them confidential? Is that clear? Is the first bit clear? This was basically the first learning objective, just a brief summary of what we've talked.
Yes.
I hope that's clear. Yeah.
Yeah.
You have all the
This is
presentations
clear.
there. You have the recordings there. You can always go through them. So the second bit, I'll quickly skim through the second, third, and fourth bit. So what was person-centered approach? Anyone? If I ask you, what was person-centered approach? Or how would you keep it person-centered in adult social care?
I think
Okay.
it's when an individual or the or when the client is being put at the center, is being involved in his own care. It is when and you take care of him or her according to his own belief, according to his choices, according to whatever he wants, not
Yes.
generalizing everything.
Yeah, thank you. Anyone else? Someone was wanting to speak as well?
Yeah, this is Solomon.
Yeah, Solomon.
Yeah, from my own view, when I talk about person-centered care, is to ensuring that people's preferences, needs, and value guide, and providing care that is respectful
Yes.
and responsive to them. That's my view of point.
Yes, exactly. Thank you both. Richard, do you have anything to speak about this?
Nothing for now. All the same answers.
Okay, that's fine.
Spoken. Yeah.
Yeah, so you
Thank
think
you.
they're okay?
Yeah, they're okay.
Okay, thank you.
Bye-bye.
Okay, so person-centered approach, we talked about why is it important, what is the benefit, and when you don't have it, what happens? Like, is it something that you really want, and can you do without it? So we had discussed and we said that it's always better to have a person-centered approach. The principles and practices of person-centered approach. So you're putting the individual at the center of whatever decision you're making, but it should be in the best interest of that person. Their assessment and planning could also be there to help facilitate in them. Person-centered thinking tools, so a range of tools could be applied. We've talked about that. Holistic planning to promote health and well-being. Importance of active participation and independence. Benefits to service users. It's always important to make them aware that they are independent of their own care. Assistive life technology. We talked about outcome-based practice. We talked about how support plans can be effectively implemented, personalization of care. We talked about different ways where the NHS also works with their own, in partnership with several partners across, and they keep them wherever care is personalized or wherever it is person-centered, it is always, it has a better outcome. Inclusive practice and promoting equality inclusion. We talked about what inclusion is, what equality is, what diversity is, important of dignity in care, how this can be achieved. Upholding and promoting service user rights, dignity agenda. Whenever there are conflicts, how do they get resolved? How do they arise? How to resolve them, and consequences of poor decisions. I hope that's clear. Then we talked about understanding safe practices in adult social care. So we talked about responsibilities for safety in care, importance of following policy and agreed ways of working, safe use of equipment. So if you have equipment, how are you going to use it safely? And if not, do you have a record? So your records should be there. Your incident cases should be there. Incident records should be there, just to see a trend. And then you need specialist training. For instance, as I said, I'm not a fire safety person. I don't have that training. So if I want to be there, I would need a fire safety specialization for that. Safeguarding practices, always be aware of signs of abuse, risk factors, responses to abuse, and allegations of abuse. Comments and complaint system should be active all the time, and you should be aware and update them regularly. We talked about how risks can be assessed. So there were different steps where we were assessing the risk, where we were identifying hazards and risks in relation to care activities, responsibilities for risk assessment, who contributes to risk assessment, and then managing that risk. So you control those risks in place to eliminate or to reduce. If they're not going to be eliminated, you at least reduce the risks. Positive risk taking, so allow them to take risks which are positive. Like for instance, after a fracture, they've been surgically operated, and then they start walking. So when do you think that it could be safest for them to walk with assistance and then without assistance? So that is giving things in their own hand, so it helps in their healing even better. Dilemmas or conflicts between service users and duty of care or risks, importance of security in health and social care setting, infection control practices and restrictive practices, how to avoid them, and when this might be acceptable, staff safety, etc. I hope that's clear.
Yeah.
Yeah. So
Sure.
I think this is the last bit that we're going to talk about. So yeah, the last one was understanding professional practice. So we talked about different professions. We talked about different codes of conduct for health care, so support workers. We talked about importance of compliance with legislation, regulation, guidance, and workplace procedures, importance of working within the role and responsibility. We talked about good practice frameworks and theories. Partnership working, we have different partnerships, we work with different people. How are those relationships going to stay healthy? Agencies that are potentially involved in partnership working, barriers to partnership working, team working, how important it is, team working, collaborative and participatory approaches to care, and how to collaborate effectively and ensure participation of service users is there on a constant basis. And establishing professions, professional relationships and difference between professional and personal relationships. So that's about it. I'm stopping sharing and I will now share with you the actual assignment discussion, which I was discussing there, but this I'll do it more formally now through a presentation. Please let me know once you can see my PowerPoint presentation. I hope the points that we've talked about are clear to everyone.
Yeah.
Yeah, okay, great. So I hope you can see my screen.
Sure.
Yeah.
Sure.
So this was supporting individuals in adult social care. So your assignment, we've talked about the learning outcomes, the learning objectives in a nutshell. That was a recap. We've talked about any questions that you would want to focus on, and then I'm happy to answer them. And then now we will focus on our assignment discussion. So the first assignment that we will talk about, like this is the scenario. So it says that you have been employed by a provider and you're working in the adult social care setup within your own chosen country. So it can be any country that you choose. It could be even the UK if you want to work here. If you want to write in your assignment, it's not working. Obviously, you're working here, but you choose any other country also. And you need to develop your knowledge and skills in relation to your own role. So as part of your development, you need to produce a number of written documents that evidence your knowledge. So how do you show that you have gained this knowledge? So your first task, your manager has asked you, has everyone understood what the scenario comprises of? So it's your chosen country, any country that you decide to write about, and you've been employed in an adult social care setup, and you need to develop your knowledge and skills in relation to your role. So what is the first task? Your manager has asked you to produce a PowerPoint presentation, and this is in regards to your communication in adult social care. You could include, or you should include, practical tips for communication or making communication accessible, as well as underpinning knowledge about communication. So whatever you've learned, please reference them. Reference at the end of the slides as we reference. We have PowerPoint presentations that have references at the end of the slides. You should produce slides and accompanying speaker notes. So anyone, any idea what speaker notes are? So these, if I tell you, this is a speaker note. So can you see my, just a minute, I'll annotate this again. Yeah. So this, if you see where my mouse is, this is a speaker note. So if I write here, so it comes here. So sometimes your PowerPoint slide, you don't want to excessively populate this. When you don't have enough space, you can always write your notes over here. These are called speaker notes. Is that clear to everyone? Yeah. So, and remember, please, this assignment is just to submit. You're not going to present it anywhere. So what would you include in your assignment? So you've got a presentation where you're talking about communication skills. So we talked about analyzing the importance of effective communication and how this can be applied in practice to meet the needs of service users. You should include an explanation of different types of communication and their uses and the need to gain consent. And then you would assess the requirements for record keeping and reporting in adult social care. So, in order to achieve a merit, your slides and speaker notes should also include where you want to evaluate the application of best interest in cases where service users are unable to consent. This is in order to go one step ahead, have a better mark. You're not required to deliver the presentation again, as I mentioned earlier. Is that clear? Task 1. So this is a PowerPoint presentation. So your task 2 will be, you've been asked to prepare a handbook about person-centered and personalized care and professional practice and partnership working. So there are 4 points: person-centered, personalized care, professional practice, partnership working in adult social care. You would want to illustrate this with examples. Your handbook, which would be a Word document, would analyze the principles and practices of person-centered approach or person-centered care and analyze the principles and practice of personalized care. So if you would want to achieve a distinction, you could also include evaluation of ways to promote and maintain a culture where practice is centered on the needs of service users. Is that clear?
Yeah.
Yeah.
Okay.
So, based question.
Yes.
It's clear.
Is it going to be on PowerPoint form or a Word?
No, this will be a Word document. So your handbook will be a
Word.
Word document. The first one was a PowerPoint presentation.
Okay, so the second one will be a Word document. The first one
Yes.
going to be the PowerPoint. Okay,
Yes.
thank you.
That's okay. Any other question? Okay, you can ask as we go ahead. Okay, so task 3 will be preparing a case study. Again, this is a Word document. You would want to prepare a case study that analyzes the care of an adult social care user. So that could be any person. And where you're explaining the underpinning elements and theories and how they impact on an individual. So you are talking about a case, a person, any person who is factitious, or it may be a real individual, but you're not going to use names or personal details. This is to ensure that confidentiality is protected. So what you would do about that adult social care, adult service user, you would talk about analyzing the care of that adult social care user and explaining the elements, the important elements and theories and how they impact on that individual. Your case study should analyze the components of professional practice in adult social care. We talked about professional practices, whoever's involved in them. And you would also want to analyze the principles and practices of partnership working in person-centered care. Again, a Word document. In order to, okay, so this is there. This is just a pass in this. Now, the task 4, I think this is the last task, yes. Your manager has requested that you produce an academic poster about safe practice in adult social care. So your academic poster should include explanation of the management of risk in adult social care and analyzing safe practices in adult social care. So in order to achieve a merit, your academic poster should discuss how conflicts or dilemmas between individual rights and the duty of care must be addressed or might be addressed. You could have a distinction here where you could assess how different agencies work to support protection of vulnerable individuals. So your PowerPoint poster, so it's a PowerPoint poster that you have. So your layout for this poster, for instance, could be just blank, or you could just have this a layout just like I have one. So it should be on a PowerPoint presentation. Is that clear? So there are 4 tasks that you have to complete, basically.
It's clear.
Yeah. And you know that you have to submit your work at learnerwork@ukversity.co.uk. So we talked about the 3rd of August, which will be your submission date. Is that clear to everyone?
Yeah,
Yes,
clear.
please.
Yeah.
Clear.
Any questions?
No question from my